I think it's an important question that liver transplant is now being done in many, many centers in the country. Before I answer that question, I must say the number of liver transplant done over the last 1 year has come down significantly because of various reasons. One is when you don't do the liver transplant for the non-urgent indications now, most of our liver transplants are for acute liver failure when we know that the patients are going to die if we don't do a liver transplant. The liver transplant, as you understand, is either a cadaver or diseased organ transplant where you get from the brain dead individual, or a life-related transplant. We are avoiding life-related transplant as of now because we are risking two individuals coming to the hospital, remaining in the hospital for a long time with a lot of contacts with various healthcare workers which is taking place. We are still doing cadaver transplant because I think cadavers are precious organs and we don't want to lose our organs. So with all precautions, we still do it. Now, coming to your specific question of liver transplant, I think the first few weeks or months after liver transplant are very, very risky because we give a lot of immunosuppressants to prevent liver transplant organ being rejected. So when you're giving so much of immunosuppression, there is a chance of getting a COVID, and the seriousness of COVID is more likely to happen in them. So if they have not received COVID vaccine before transplant, we always plan to give them a COVID vaccine. But there is no consensus as to when should they receive the COVID vaccine. In generally, you would want to give the COVID vaccine to the post-transplant people only after 2 to 3 months, because that's the first 2 to 3 months when there's a lot of immunity issues. So after 2 to 3 months, when they are stabilized, you give them vaccine. But then actually, the data do not show that these people are at more risk of mortality compared to non-liver transplant. So liver transplant after the initial 2 or 3 months are pretty safe in the COVID era. But then I would also suggest that this is the time when these individuals should not come to the hospital unnecessarily. I think teleconsultation, talking to your doctors over phone, whatever can be done without coming to the hospital should be done, because after all, they're somewhat immunosuppressed. But in general, there is nothing to fear. After 2 to 3 months of transplant, you are as good as any other individual.